I will ask patients, are you worried that you have cancer? And I think it's important to say that because sometimes they can't articulate it.
Yeah.
They say, oh, I have this spot, and I didn't have it last year, and they're dancing around something. I'll say, do you think you have cancer? And they'll be, I don't know, can you look?
Are you tired of feeling like a contortionist after a long day working in clinical practice? This message is brought to you by our sponsors at Designs for Vision, who are offering you a 45-day free trial of any of their loops. But I strongly encourage you to try their ergonomic loops called Infinity View. Say goodbye to your chin down, neck cranked, poor posture, dental procedure and practice. All you have to do is go to their website, submit a form in order to get your rep to reach out to you, get measured, and get your loops. And then you get 45 days to figure out if you like them or if there's anything that you want to change. You can just send them back, but I don't think you will. So buckle up, get ready to rock the Infinity View loops and say hello to a life filled with joy, comfort, and amazing posture. Thank you, Designs for Vision, for creating these beautiful loops. I can't go back to my old ones, ever.
Welcome back to another episode of the Toothlife podcast, Peeps with Your Peep, Irene. And welcome back for part 2 with Dr. Renée Beach, owner of DermAtelier here in Toronto. And if you missed part 1, we talked a little bit about her journey into dermatology. And now we're going to focus on your favorite things, the products and the procedures. And let me give you or paint you a picture, remind you, because I came to see you for the first time because of these struggles back in 2020, 2021. We dental people are still very much wearing heavy PPE, N95s, face shields, gowns. Most of us are still in closed operatories, although it's not required. Back in COVID times, I was working in a plastic bubble, so it's plastic sheet stuff, and we were not allowed to have our air conditioning on or any circulation of air because of the generation of aerosols and this perceived notion that aerosols were going to infect the entire office. So there's some people that are still working in environments like that, although the PPE is still in place. What could we be doing? What are some aside from hydration, which is very important.
Yeah.
Let's start with that simple thing. So let's start with something as simple as hydration. Like, what are the effects of being dehydrated on your skin?
I mean, it makes the skin look dull. It makes the skin flaky. It makes the skin feel tight. All the things that we associate with, dry, eczema-prone skin. That's what happens when there's a lack of hydration, either at, the epidermal level or, when somebody's actually dehydrated or more, body volume scenario when you get seeing those cracked lips.
Yeah.
That's an indicator. I think for the dental professionals, with skincare, you need to be very intentional and less is more. I don't have a problem with layering on product. For example, if you say, listen, for me to feel my best and look my best, I need my serum and my sunscreen and my concealer or what have you. But it's also being practical. These are not products that if you have an N95 mask on or you have other protective equipment on that you necessarily want to be reapplying every couple hours because it's just getting congested.
Yeah.
It's just getting confined. I would think that
to the heat of your own breath.
Yeah.
that there have been some studies that have indicated people with poor oral hygiene. It does affect the skin around the oral cavity because we've got such high loads of bacteria throughout the day. So like the Streptococcus mutans and the lactobacilli and some of the more pathogen-prone oral bacteria can affect, what's happening to your lips and to the extremities around your mouth because especially if you're a mouth breather with a mask on.
Right. Yeah.
It's a lot of bacteria. Yeah. The look on your face, you're like, oh, didn't think of that. You dental people.
I often recommend things that are water-based.
Yeah.
And really it's a matter of turning around your product and making sure it's water-based. I do, people need things that are simple, practical points. So, for example, people say, what should I use? It's very rare that I will endorse a single brand or a single product, but I do have certain principles. So when you're looking at your facial cleanser, you want to make sure that the ingredients in it, there's probably 20 or less ingredients. And those ingredients ideally does not include fragrance.
Yeah.
If it has oils in it, those oils are further down the list, indicating that they're of a lesser proportion, the ingredient composite or the makeup of the product. For cleansers, I don't like to use more than one active a day. So for example, if you're acne prone and you're using a salicylic acid cleanser in the daytime, you're not using that again at night. If you're using something that has, benzoyl peroxide in it, again, it's one and done. You're not repeating it at night. For your hyaluronic acid layer, especially if it's going to be under occlusion, I like something that's really basic. So you're looking at something that has maybe 15 ingredients or less.
Yeah.
It's water-based. It's colorless. You're not filling it with dyes and perfumes. And ideally, it's in a pump delivery. So when it's delivered, it's clean. It may not be completely sterile, but at least it's a clean delivery as opposed to a jar that you're dipping your hands into.
Yeah.
And then if I were a dental professional, I'd do my cleanser, my hyaluronic acid, or vitamin C, and then I'd finish with sunscreen.
Yeah.
I actually wouldn't put moisturizer in because, again, you're creating that moisture tent with your PPE. So I would use a sunscreen that, maybe is a lotion or a cream and has some hydration as part of it, and wear that.
Yeah. That was something that you said to me when I met you for the first time and did your consultation before we kind of discussed all of the other stuff. And I wasn't wearing sunscreen regularly. And you said something, you said, well, why? I'm like, well, I only go to work and I'm home, and some days I'm working from home. And you said, do you have plants? And I said, yes. And then you're like, do your plants all live outside? And I'm like, no, I have a tree in my living room. And you're like, and it grows, right? And I'm like, yeah.
So I was
you're trailing me along to this photosynthesis lecture, and I felt like I was in grade 9 science again. I'm like, okay, noted. Yes, trees grow inside, therefore sun reaches your skin even if you are inside. So since then, I've always used, and you provided me with 2 sunscreens, and it was the SkinCeuticals sunscreen. I believe it was like a gray. And one was tinted and one was not tinted.
Yes.
So I learned the lesson of tinted. That was the lesson I learned. Can you believe it? I was in my 30s.
Hey, you know what? It's never too late.
So I learned about tinted sunscreen, and life has been lifing since then. But it was this trailing along of let's just let this seemingly smart girl catch up. You're like, and the plants grow inside, right? I was like, yeah.
Light everywhere.
Wow.
Yeah.
And you had a really great kind of comprehensive list of drugstore brand stuff versus non-drugstore brand stuff that you openly and willingly shared with the things that you like and the things that you don't like. And those are things that I still use, like the hyaluronic acid, the blue bottle from, I can't remember what it's called, but it's like a Shoppers Drug Mart.
Okay, so maybe the Vichy.
Yeah. Like that is a very easy and accessible thing. And I think people often think that seeing a dermatologist and going into a dermatology clinic, you are bound by the products that they sell.
Yeah.
But you were very transparent that you buy them from here, have them at the front, or here's a list of stuff that perhaps is a lower price point to them that you still, and I thought that's very respectable.
I think it's important, everybody's coming in with a different level of comfort, different level of spending comfort, and the needs are the same, protect the skin and hydrate the skin and improve the skin. So if I can give you options for that, there's always going to be options. It may be that I think this is number 1 and this is number 2, but there's still a number 2.
Yeah.
And I think it's, important for everybody to always have those options. So we have curated a list in clinic. We keep it to 1 page. It covers everything from facial cleanser to, even toothpaste.
Yeah.
For products that for people who tend to have more reactive or sensitive skin. And it's very clear, whatever's bold means that we have it here in the clinic for purchase. But, there's other outlets as well and other options that are, just as good at retail stores. And I think that people appreciate it because it just opens things up to them.
Yeah.
I'll be honest, I always have a favorite. I
Sure.
always have one that I'm going to rank number one. And there's some things that are just really nice and luxurious, and that's okay, to treat yourself with skincare. But there are people who say, listen, I've got other priorities, I've got a budget, and this is what's going to fit my budget. And so we have those conversations regularly.
And the convenience too. I mean, if it's something that you have here and like for a patient, perhaps like me, I'm a 40-minute drive with traffic to come to you. Like maybe we'll grab this stuff when we're here, but then you're going to run out. It's not a lifetime supply of a tiny little, or you forget it at an airport or a date. I just came back from Barcelona and Ireland, and on my way home from Ireland, like let's talk about TSA for a moment. Like the risk to homeland security or whatever security of having a volume more than 100 mLs. So like filling up a tiny little Ziploc bag.
Yeah.
I need all of these
your world.
things. With my world, with all the things that don't, they sometimes don't even come in a small container. So having multiples of something is helpful. Now I just have a travel bag with 2 of everything. So I no longer have to segment and move things back and forth. But it's nice to have some options where I'll pick it up when I'm there next. But in the meantime, I'll try this other thing that I can get from the drugstore.
And that was actually one of the impetuses for us finally developing our online store.
Oh, I didn't know that you had an online store.
Yeah, I mean, I think when COVID started, there were just so many other moving parts. So it's like, just get the thing up and running. But it's become clear that, there is the expectation that I can purchase it online.
Yeah.
So we have that infrastructure up now. And it's great because it saves you a 40-minute drive with traffic.
Yeah, that's really great. Let's talk about hand hygiene for a moment and this maintenance of skin on the hands. Like we know that we're supposed to carry our products down into our neck and as far down as possible.
Yeah.
But we dental people are washing our hands sometimes 3 times per patient. And lotions and sanitizers are still very much a thing. And I suspect that you have the same problems too in medicine. So what could we be doing better on the hand side? I also am covered in temporary tattoos when I feed children at the office. I don't know if these are toxic, but I hope not, because I usually have like 50 of them on in any given month.
I one of the things that I find really important is having a sink in each room. You say, well, duh, but in medicine, that's not always the case.
Oh.
I worked in offices where they didn't have a sink in each room, and because it's a cost saving measure. But having a sink for me is far more preferable than using a hand sanitizer. Certainly hand sanitizer is convenient. It's on the go. You don't always have access to a sink, but I much prefer, washing hands with a hydrating cleanser. So you're going to there's this whole category of cleansers called synthets, which is synthetic detergents. And they basically are packed with humectants and some cleansing agents, but they're not going to foam up. They're not going to have fragrance. They're not going to have any things that are scrubbing beads or exfoliants. Yeah. And they do the job. The biggest thing with hand washing is the time taken. So they talk about, 20 to 25 seconds and, doing the various areas underneath the nails, each finger at a time, but also is drying them off. So drying them off in, a disposable towelette or paper towel or something that, you're going to be able to discard to be able to physically remove the residues that you've just got from your hand washing. And I think that in a public space is a lot of the time forgotten. How many times you go into a public bathroom and they have a hand dryer. They have an air dryer that you're supposed to just, use. And we know that the mechanics of actually removing something with a paper towel is important. And we miss that in a hand dryer and we miss that in a hand sanitizer.
So we have a hand dryer in our bathroom in our office. So is that worse or better?
It's considered at risk for leaving more microbes on the hands. Yeah.
Interesting.
Yeah. So, but from an environmental standpoint, you're ahead. So it's what do you take from your practice? What do you decide to do? Do you want to?
Our bathroom does the hair dryer, but our operatories all have sinks with paper towel disposal.
Yeah. So, I mean, there's some people that would argue, well, straddle both sides of it and you dry them until they're, 50% dry or 75%, and then you
try and put gloves on.
Wipe the rest. Yeah, that's it.
In front of a patient.
Yeah, look like it's your first day.
It's my first day. And then, there are some dental companies that make products specific for hand washing and for hand hygiene and lotions and things that are recommended to be put on between patients. But Then there are the glove companies that say that you're not supposed to be putting on these lotions because then it interferes with the breakdown of the glove from the inside. Now, we're not wearing latex gloves anymore. I hope no one is wearing latex gloves anymore, especially the powdered ones, which would absorb some of that moisture and make it easier for your hands to, but, what do we do in that case? Like, should we be doing any specific hand treatments? How do you feel about paraffin baths? Because there are some dental offices that have those.
I think that I think they feel nice.
Yeah.
I think
are they doing anything?
No, they are adding some protection. They are. I just don't think they're practical.
Right.
You can't stop between every patient and do that. Like, it's just not going to
just walk around.
They're adding a barrier of protection.
Right.
Hopefully you don't get sensitized to any of the elements in the wax.
Right.
But this is going to sound kind of crazy, but it also means taking the time away.
Yeah.
So, if you're working an 8 or a 10-hour day, it means trying to find the time to rest the hands, because invariably people come in and they say, oh yeah, when I'm away from work, it's better.
Right.
My symptoms lessen.
My eczema's gone. It's also the stress levels and the cortisol levels. Like all of those stress hormones all are affected. And hands arguably and necks age more than faces because we are very protective of our skin and hopefully doing all of the right things. But then we forget about some of these other elements. So you see these beautiful celebrities with the perfect skin, and then you look at their necks and their hands, and it's like, well, age too. Yes. In order to really make sure that you're creating this entire system, or you're treating the entire organ, not just the places where people see it most.
Yeah, I think the hands do tend to be forgotten. I think for me, my advice to people is try to make sure you always have something with you. So you always have that pocket-sized cleanser. That's like I said, the Syndet category. And you want to make sure that your hand cream is delivered in a pump or in a tube.
Clean dose.
So that it's being delivered without dipping into a jar. And that the funny thing I find is people put on hand cream and they go like this. And no, just don't waste it. Put it right on the back of your hand from the get-go.
Yeah.
And then you can go like this. And it's an awkward application, but then it's not a wasted application.
Right.
You don't necessarily
need it on your palms.
Not necessarily.
Yeah.
People don't tend to need it as much. It's usually the outside.
Interesting.
Yeah.
How do you feel about supplementation with collagen? And that's, you see these viral posts, people are mixing collagen into their smoothies, and what is the bioavailability of something like that? Are we getting any extra collagen from it?
That's been a huge debate, and it's been a debate for quite a few years, and you're hitting on it exactly. The whole thing was, are we actually absorbing this?
Yeah.
Now, there have been some studies that marine-based collagen does in collagen type 1 and type 3, when it's been refined, it has been able to penetrate the microcirculation of the dermis and help the skin. But we are talking to small amounts. So we're not able to quantify this on any particular scale. It's mostly when people are looking at clinical comparisons, they say, oh, the skin looks smoother, it looks more taut, it feels better. So I don't have a problem with people taking collagen supplementation. I think keep your expectations low, managed. And it's a lot of, I find the same thing with cosmetic advancements, is with medical advancements, I always say I'm very quick to adapt. I'm very responsive. It's been vetted, it's done that randomized placebo-controlled trial. All those things have been met. With cosmetic things or, alternative medicine things, oftentimes there isn't as much data, or the data that we have is not as high a level of scrutiny. Mm-hmm. And so that's an area where personally I'm not a fast adapter. I do like to sit back and see a little bit where the dust settles, and then make my decision about where it fits for me, for my patients, for my practice. Yeah. And for collagen, it's not something that I recommend out the gate. But if somebody's taking it, I just try to make sure that we look at the brand, and I can make sure that it looks like it would be appropriate collagen form and has some potential to be absorbed.
Yeah. And some research behind it.
And there is some research. Yeah. There's even Canadian data. Yeah. I just tell people, look, you're not getting a facelift from your collagen supplementation. Right.
And you could be just looking better as well because now you're taking it in a liquid source, which means you are better hydrated than you were before. Like,
That's true.
So now you're putting it in a smoothie instead of eating bacon and eggs for breakfast. So that's going to increase not only your collagen uptake, but your vitamin increase. So you're taking, what kind of, it's blueberry. So you're increasing your antioxidants as well. So it's like this amalgamation of little things that compounds perhaps to having this like perceived improvement that you're targeting towards one thing. It's like the same thing happens in dentistry. Well, someone will come back and say, and they're cavity free all of a sudden.
Okay.
But it must be the toothpaste that they're using. It's not, that they replace their toothbrush head or that they're brushing for an additional minute instead of 2 minutes, or now they're cleaning between their teeth with a water flosser. It's like this, change in an overall habit.
Yeah.
Or they're even healthier. Like there's some signs that oral health is directly coordinated and connected to people that are physically active.
Right. Okay.
So, there's a lot of different connections that someone's like, well, I'm cavity free. It's because I'm not eating sugar anymore.
Yeah.
It's like, well, no, there's probably 10 other things that you're doing better or that is now one of the symptoms of. So let's talk a little bit about that, about dentistry and dermatology. Some of the connection, we talked about the bacteria that's found in the mouth that sometimes might, rear its ugly head and some of the skin issues that we have. What types of things do you look for that can connect skin to systemic health? And
I think there's some of the things that are, more common or maybe less exciting. And that's just basically, looking at somebody's tongue. Is it stained? They have a black hairy tongue. Do they have a nicotine stained tongue? And just, reminding them, hey, are you thinking about quitting? What stage are you at? Are you contemplating? Are you in practice of doing it? So, basic things like that. Definitely, I look for any erosion for things like
GERD or acid reflux.
But also things like pemphigus. Or even forms of lichen planus. That can definitely affect the gingiva and erode areas and be really uncomfortable for patients, eating and drinking. And so trying to liaise with a couple of dentist colleagues to say what can be compounded or what's already out there that can be taken and that will be effective and not harming to our patients. So it's hard because, you need things like gels and ointments, swishing and spitting, and we depend on our compounding pharmacy. And then you get to the point where you're like, you know what? You really just need to swallow this medication and let it come back through the bloodstream. So it's getting patients' mind around that and head around it and understanding that a lot of things we manage as opposed to cure.
Sure.
So I'm really happy if my pemphigus patient only needs to come in twice a year.
Yeah.
And they're like, I had a flare up because I, didn't take my meds or I, went on vacation and was eating a lot of spicy food or what have you. But otherwise I'm okay. So understanding that there's certain conditions we manage.
Yeah. I had a patient with sarcoidosis of the face, primarily around her mouth and her nose, and the gingiva was quite raw and rare and red and irritated. So she had a very hard time eating anything acidic, tomatoes and citrus fruits and even certain like beverages she just couldn't have. And when she had these like flare-ups, they were quite painful. And interestingly enough, most recently, this patient who is a wonderful human and has signed a release for me to write a paper about him.
Oh, wow.
2 years ago, he came in with white patches that seemed to be lichen planus on the buccal quarters of his teeth, of his cheeks and of his gingiva. And this one particular red patch on the front teeth, it kind of looked like an orange peel. Quite inflamed and red, and sent him off for a biopsy. They biopsied a different area, not both areas. Came back saying lichen planus, which like we agreed with in that one area, but it was this front area that was looking very strange. And he went on a family vacation about 3 months later, collapsed, took him to the ER. Turns out he had leukemia. And I hadn't seen him for quite some time. And whenever a patient goes inactive in my office for 18 months or more, I pick up the phone and I call, just out of, concern. It's okay if you've moved or if you've decided to see another clinician, but I always want to make sure that someone has a continuation of care somewhere. I picked up the call phone and he said, I've been in terrible health, a young guy, 34. It turned out I had leukemia. And I was like, wait a minute. So I, looked back in the records, looked back in the photos, and turns out that lesion is pretty definitive with someone with leukemia. I went back to the referral and, not to throw shade at anybody because we all make mistakes, but it was just like that one time you had this gut instinct. So, there's in dentistry, we're very much connected to the oral systemic link. And that oral systemic link is in bacteria. It's, the bacteria that's found in the mouth is the same bacteria that we find in patients with atherosclerotic plaque buildup in the heart, patients with spirochetes found in the brain of those with Alzheimer's. So it's a very, connective thing, and the mouth being that opening to so many systems. When I was in school, we learned about a bunch of different skin conditions that could lead to someone having increased prevalence of tooth loss from periodontal disease and gingivitis. Some of them that perhaps you find, like skin tags, for example, around the neck, acanthosis, which is that kind of velvety, black,
thickening, acanthosis nigricans.
Yeah, and anytime I see, skin tags or acanthosis nigricans. Yeah. That to me is like it's not in my scope of practice, but sometimes it's a deviation of normal. Same thing. I had a patient with skin tags everywhere, all over her neck, just sporadic. Sent her to her family doctor. Turns out she's pregnant and had pregnancy-induced diabetes. So it's just like these little things that they may never be anything.
The eruptive
but
skin
it
tags
could be something.
Wow.
And there was another patient who I saw had what appeared to be like broken capillaries on the face.
Okay.
Turns out it's something called mitral fauces, and it turned out he had high blood pressure and three blocked arteries.
Oh,
so it's like these little tiny things that, had I not read that paper that one time, and now it becomes part of this checklist. But it's probably stuff that you see like regularly.
We do, but still, definitely the acanthosis nigricans, it's a tough conversation.
Yeah.
Because you're having a conversation with somebody about their, insulin resistance.
Yeah.
And the fact that they're at risk for diabetes, and the fact that it means they have to make some pretty significant lifestyle changes.
Yeah.
And they may not want to hear it. They may not be there yet. They may not understand.
Yeah.
And the idea that, well, can't you just give me this cream to make it better?
Make it go away.
Because a lot, like 80% of the time, we can. It's just not that type of circumstance.
But that's not and then, other types of things that you might see related to systemic health. How much of the distribution of your patient load would you say are people coming in trying to manage symptoms of systemic health issues? Like, how many times do you see someone with fingernails that are like out of form, and they're coming to see you, but it turns out they either have like a pulmonary issue or cancer?
Yeah. So
are those rare?
Funny. I hope it's rare. I think about whenever I have a referral, I make a point of reading the referral in the room. And the reason why is because it's complete transparency. I want you to know why your doctor or nurse practitioner determined that you need to be here.
Mm-hmm.
And, I'd say 85, maybe 90% of the time, they're like, yep, that's why I'm here. And then there's that little 10% or so that say, oh, I thought I was coming for such and such.
Oh.
Or, you know what, I know I was sent for that, but I really want to talk about this today. And so I try to make sure that they know why they were being sent here, whether or not it's still active or it's gone dormant or resolved, and also to meet somewhere in the middle. So I will say to patients, you know what, I need to respect your referring practitioner and make sure that we at least cover this today and we can touch on the other thing. I will ask patients, are you worried that you have cancer? And I think it's important to say that because sometimes they can't articulate it.
Yeah.
They say, I have this spot, and, I didn't have it last year, and they're dancing around something. I'll say, do you think you have cancer? And they'll be, I don't know. Can you look? And then I'm like, you know what? I'll
say it. Say it out loud.
It's okay. I'll look. I can say that I have a couple patients in my practice who do have cutaneous manifestations of lymphoma, and they're long running indolent lymphomas, but they're still there. So it's always in the back of my mind whenever I see a change, particularly if somebody's elderly. And sometimes we get the referral and the physician already knows, or the referring person already knows this is on the background. And sometimes sometimes the dermatologist comes in and, is the nail in the coffin and says, well, this is because of this. And this is the diagnosis that ties it all together, which is why dermatology is useful. And sometimes I bring things up. So for example, I had a patient who came in with all sorts of cysts and odd looking acne things. Later into life, I said, oh yeah, my mother had the same thing. And so you're sort of getting this spidey sense, like this is more than just acne. Asked for backup, asked for an opinion, sent the patient to the patient viewing rounds that are done at the university. And they came back and said, there are a couple syndromes that this patient may have, and that they should be checked for, starting with an assessment of one of their nodules to see whether it's diagnosis X or Y. If it's X, then they should get a colonoscopy because they could have colon cancer. Yeah. So yes, it does go up the tree, up the ladder. And I can't say it's every day, but it certainly is enough that dermatologist's unique skill set is welcome in those cases.
Well, I'm sensitive to your time because I know you have patients coming up. So is anything that, any parting words of wisdom to us dental people in treating and assessing, I think, patients in order to be more allied with dermatology? If there's anything that you can think of.
I think it's trying to get to know, if you have somebody in the area that's a dermatologist, I think making that introduction is important. I know that there's a couple of dental professionals. If I have a question, I can pitch it to them. I mean,
I would be one of them.
Not to overburden anybody, but I think it's good to sort of know who they are. And you know what, the practice overlap may be very small. On a day-to-day basis, it might be 1% or 5% or something, but it's still really helpful. And those patients will never feel like, the 1%, 5%. They're going to feel like, I was completely looked out for. I had coordinated care. I had comprehensive care.
That's great. Thank you for taking the time to chat with us. I'll link all of your stuff in the description below.
Oh, yes.
So all of the dental people can probably comment on your posts and things. I'm sure that is. So thank you so much for being here today.